everyone, Tanya Siddiqui here, and our today's guest is a child psychologist. She has a master's in clinical psychology from South Africa. She works with both children and adolescents, and she's registered with the Healthcare Professionals Council of the UK, and she's licensed to practice in UK, Dubai, and South Africa. And currently she's working in Dubai Healthcare City. So let's welcome Prathna Singh. Hello, Prathna. Welcome, and thank you for being here today to share your experience and expertise with us.
Hi, Tanya. I'm very well, thank you. Thank you so much for having me on today.
Oh, you're most welcome. So please, can you tell us about yourself?
Sure. So, Tanya, I am a child and adolescent clinical psychologist. I work at a clinic in Dubai Healthcare City, and I work as a psychologist who sees children from the age of about 5 years old right up until the age of about 18 years.
Okay. Oh, that's nice. So, what symptoms or signs do you notice in children with healthy brain development versus unhealthy brain development in your practice?
Sure. Okay. So, the field of child psychology is quite a diverse field, and we have very different and very varied presentations that children might present to a clinic with.
Mm-hmm.
So we've got what we know as neurodevelopmental conditions. So if you look at that word neurodevelopmental, the word neuro tells you that it has something to do with the brain, and developmental means that we often start to see early signs of these difficulties. So it might be in early childhood that we start to pick up on some of these neurodevelopmental conditions. So examples of this might be something like an autism spectrum condition. It could also be something like attention deficit and hyperactivity disorder. And it could also be other conditions which have a clear neurological basis, like, for example, Tourette's disorder, or you might find, I think there might be some teachers that are listening into this as well. So, a child in your class who has tics, and then we would call this, if it's a bit more complex presentation, if there are multiple different aspects of their development that are affected, there are other mental health presentations in children as well. So we see some children who, they have difficulties with anxiety, they have difficulties with low mood. But this is a presentation which is more rooted in their mental health and in their well-being, and is more a psychological or a psychiatric kind of condition. So we see these. And of course, children will present very differently to adults. So they don't always have the vocabulary or the words to express how they're feeling. So they might be presenting with a lot of physical complaints, like stomach ache, headache, those sort of difficulties. And it's very important for the parents and for the teachers, just for the adults in children's lives, to be aware of when things are not going so well with children. And of course, very importantly, we know that there are always some expectations for children as they're growing up. So by 1 year of age, we would expect a child to be doing something. By 2 years of age, we would expect a child to be doing something. So these are what we call developmental milestones. So we would expect a child to walk at a certain age, to talk at a certain age, to be toilet trained by a certain age. And of course, there might be some variations in that, and there might be some delays in that. But when this is a significant delay, and when the people in that child's life are picking up that it's causing a lot of impairment or causing a lot of difficulty in the child's life, and it is, if you compare that child to their peers or to their siblings, and you see that then they're just not making the progress that they should be, and this is also a red flag that actually, you know what, this child is actually, there might be something in terms of the brain development which needs to be monitored. And that's the red.
Yeah. Okay. And what issues you commonly see in children, in your career? What are the most common issues?
Okay, so very much what I already touched on. I see in my practice a lot of children who present with mental health issues. So anxiety is a very common presentation that we see, and that anxiety can take different forms. So some children might have difficulty with separation anxiety, so being away from their parents. Other children might have a presentation which we call social anxiety. So they have difficulty being in social environments, they have a fear of being judged by other people, or they might even have something which we call um, OCD. So there are different presentations and different manifestations of difficulties that we see in children. And then, of course, we've got children who might present with some difficulties such as that are affecting their mood. So they find it difficult to regulate their mood. They find it difficult to regulate their emotions as well. We find that particularly in the younger children, around about 5, a lot of parents come to us at that age and they talk to us about their child having tantrums or having meltdowns. So we see these types of presentations, and we also see the more neurodevelopmental conditions, which are the autism spectrum conditions, and as I mentioned before, ADHD and Tourette's as well.
All right. So do you see any pattern in these children, for example, any type of abuse or neglect when children have these anxiety disorders?
Sure. So what we talk about in psychology is we always look at this idea of risk factors. So risk factors, there can be risk factors in the child, it's the actual child, so the child, depending on the development of that child. So right from when the child was in the womb of the mother, and let's say the mother took some, some substances, or, there was some trauma that happened inside. So that is a risk factor in itself. Those are some risk factors. And then after the child's birth as well is an very important time. So whether that child had enough oxygen to the brain, how that child was developing after that time, the care that happened after the birth. So those are some individual risk factors. But then you go to more family risk factors, and family risk factors which might make a child vulnerable to the development of certain conditions might be, for example, how the parents engage with the child. It might be the relationships that the parents have with each other. So if the child comes from an environment where there is not much care that's given to the child, where the needs of the child are neglected, or the needs of the child are ignored, or if there's a lot of conflict in the family, or if there's trauma in the family. So these are risk factors which put a child again in a vulnerable position that they might end up developing some conditions. And then, of course, we look at broader social factors as well. So whether that child is living in an environment which is conducive to their learning and to their development, whether they're able to access educational resources that can help them. So there's lots of different factors at play. It's quite a dynamic interaction of different things. So you might have one child that presents with certain risk factors, that are very individually based, but another child who has more kind of sort of community or family-based risk factors that make them vulnerable to conditions. And as psychologists, we are always keeping an eye out to see what are the specific risk factors in this child. And equally, while there are risk factors, there are also protective factors. So there are things which actually build resilience in children and help them to thrive despite being in difficult or having difficult conditions to deal with.
All right. So is there any way to understand that a child is beginning to show behaviors that are not perceived normal? Because parents are often concerned, and they want their children to be detected early in life so they can be cured and healed.
Yes, absolutely. So what I spoke about earlier is very important, is the idea of developmental milestones. So it is important for parents to be aware of when children are not making the progress that they need to be. And those are usually, we get the early warning signs. So as I say, like by a particular age, a parent should know, okay, my child is not really, their motor skills are not really developed. Their language skills are not so developed. I'm noticing when I look at how if the child has maybe older siblings and they developed typically, or they develop normally, the parent might say, actually, you know what, for this child, I noticed that they were very fast in reaching their developmental milestones. But with this my second child, for example, they're taking a bit slower. So again, you might want those, that's again just an indication that you might need to check something out. And of course, as I said before as well, it's important to be aware of any behavioral changes in your child. So, if your child seems to be developing typically or normally, and then there seems to be something that has happened, and then there's a sudden change in their behavior, it's important as well to monitor that and to see. It could be changes in their eating patterns, it could be changes in their sleeping patterns. All these are indications and clues that there might just be something that needs further investigation. And this could be something also that is transient, or it can be resolved very quickly. But actually, sometimes it might be a bit more prolonged, and that gives us indication that there's something amiss or something wrong that we need to investigate. And also it's very important not only to look at the physical milestones, but it's also to be aware as well of the social and emotional development of children. So are they interacting with you as the parent? Are they able to play? Are they able to have eye contact with you? Are they able to engage with you? Are they able to follow you when you're pointing at different things? So those are all aspects that you need to be considering as well. So there's the very kind of the medical or the physical milestones that they reach, but there's also the social and emotional development that as parents and adults we need to be aware of, that the child is not making progress in those domains. And then you might need to speak to a professional like a doctor just to talk if you have concerns, or to a psychologist to see if the child is indeed making progress or whether there is a delay or a lag in their development.
Okay. So what technique do you use to assist children when they have these problems?
Okay. So for younger children, we tend to work a lot with the parents. So parents are very, very critical because, of course, the parents will be able to put into place all of the recommendations and the measures that we as professionals will offer to them. So we never like to see children just on their own because yes, we can use things like play therapy. We can use things. There are actually so many different types of therapies that are coming out now, but we always look for something that's evidence-based. So evidence-based means that there's a strong body of research behind supporting that intervention. And I know again that there are teachers listening, and that's really important. So if you're referring to a psychologist or you're referring to somebody, to a professional, make sure that they're using evidence-based interventions, that they're not just using, something that doesn't have a backing and that's not scientifically shown to have an effect on children. So there are many different modalities, there are many different types of therapies. What I tend to use in my practice, particularly for as children get older, is I use cognitive behavioral therapy. And cognitive, so this is for children, for example, that present with or that have issues with anxiety or low mood. So this is the words cognitive behavioral means cognitive. We're working on their thinking, but we're also working on their behaviors. What can they do to improve and to change some of the behaviors that are problematic? Um, and yeah, so using modalities like that have a strong scientific backing is very, very important.
And we can use these technique on small children as well?
So for the younger children, we tend to use more play-based techniques.
Okay.
So we use, for example, what we call social stories to help children.
Okay.
We use play. So we actually play with children, and we try to teach them particular skills to help them through that play. And we get the parents as well to be more aware of how they're engaging with children. So in a way, you can use cognitive behavioral therapy. You can use the principles of cognitive behavioral therapy for younger children, but you'll adapt it to their specific age. So you wouldn't necessarily be just talking to them about it. An older child, for example, you can talk and you can just have a discussion about it. But a younger child, you find more creative ways to bring some of that thinking. And you tell them a story. You show them through your play. This is thinking this, and this is doing this, and how we can do these things differently. So it's just finding those more creative and accessible ways that a younger child will be able to understand some of those concepts.
Right. So would you have any advice to parents or teachers of young children on how to raise children so they grow up to be socially and emotionally competent adults?
That's a nice question. So I think what I always say is, which I think is very important, is it all starts with the parents themselves. And we often forget that, we forget as adults that the way that we manage and regulate our own emotions is very important because children really pick up on that. They're like these little detectives and they pick up very quickly when parents are, anxious or parents are depressed or whatever it might be. And I particularly found that during the recent times, so during the COVID-19 pandemic, we found a lot of parents who were struggling themselves. And as a result, they were picking up that their children are actually encountering a lot of difficulty. So this is very important. So as parents, we need to be aware, as adults, we need to be aware of the behaviors that we're modeling for children. Are we showing children that when we get stressed and when we get anxious, that I can go outside for a little while, I can take a few breaths, I can talk to myself in a calm way, I can do these types of things. These are very, very important. So the first point is always that parents should try to ensure that their own mental health needs are taken care of and that they're looking after themselves. And then they can look at their children and they can look at creating a safe space for their children to thrive in. So, that safe space would be a space where they're giving the child, they're allowing the child to regulate their emotions. They're also giving the child stimulation. They're giving the child, they're playing with the child. They're promoting that brain development. They're talking to their children. They're making the time to spend with their children. This is very important because when you make that time to spend with your children, you'll also be able to notice again any changes from how they ordinarily are. And if anything is happening in their lives, if anything's going wrong, you're able to better pick up on that. And I know a lot of parents are working and it's sometimes difficult to have that quality time. And I know there are a lot of nannies and a lot of other people that are looking after children.
Yeah.
But I think it's very possible for parents to be more involved in their children's lives.
So to summarize, I think you think that quality time as well as modeling behavior is important for children to regulate their emotions and to
Absolutely.
become competent, socially and emotionally competent as they grow up. Okay, sure.
Absolutely. And I think as well for parents also to very much encourage children to express about their emotions,
Yeah,
And
yeah.
again, that can be done through modeling because you want to help your child to get an
Mhm.
emotional vocabulary. Oh, I'm feeling stressed, or I'm feeling angry, or I'm feeling happy, or I'm feeling upset. Modeling that for them and also getting them to increasingly express how they're feeling. That sets up the ability later on for them to be able to actually have that emotional literacy.
Thank you, Prathna, for the valuable information. I'm sure the caregivers and educators will benefit from it.
Thank you so much, Tanya, for having me on. I really appreciate being here, and I hope that this will be valuable to all that have been watching.
Thank you.